in my second year of high school, I contracted malaria while we were visiting there. So hopefully the malaria was treated. Today we are breaking down and reacting to some of the most unusual medical stories and patient mishaps sent in by some of you. Don't worry, I'll keep it anonymous. All right, let's dive right in. I got poisoned by gold. Oh, interesting. Don't eat gold.
I love gold.
Heavy metals such as like lead, arsenic, they all kind of fall under the same category of causing nausea, vomiting, upset stomach. It can also cause numbness and tingling of your hands. Basically, the treatment is stop ingesting it or stop getting exposure to it. And then the other component is chelation, basically binding to it. Different agents such as dimercaprol, or other word is BAL, and other different types of medication. So if you have these general symptoms and they're persistent over a period of time, go to your doctor, get checked out, and they actually can run tests to see if you have these. Now, other people may have symptoms of gold hypersensitivity because gold is in jewelry. You can have like an allergic type reaction reacting to your skin, and that's a different type of pathology. Typically, it's treated like a normal reaction. 1, remove the offending agent, and then 2, treat with topical medications if it's local, and then treat with systemic or ingested medications if it's fully within your body, like hives all over the place, difficulty breathing, swelling, those sorts of things. When I was younger, I swallowed a bunch of coins and it hurt like heck on my insides. Then I drank some water and it felt better. Needless to say, when I took a poop later, it sounded like old-timey cash register. Okay. Swallowing coins is actually a common thing that we see in the emergency department, and we do pretty much get worried if it gets stuck in an airway. Coins in themselves will pass through your gastrointestinal tract. They'll go into your stomach, they'll go through your small intestine, large intestine, and you will push them out. If you accidentally inhale a coin, that needs to be emergently taken out, and sometimes if the coin is very large, it can get stuck in the esophagus or into the stomach. So we'll do basically x-rays of somebody when they come to the emergency department, and if you ever see an x-ray of a coin stuck in the airway, it most likely is going to appear this way, where you see the thin part looking at you on a plain film, and that is because the vocal cords go in this direction, and so it's got to go through it like a slot machine. Typically, if you see it flat, where you can actually see the whole coin, that typically means it's stuck in the esophagus. If it's stuck in the esophagus, you need a gastroenterologist to come and do an upper endoscopy to remove it. If it's stuck in the airway, you need a pulmonologist to do a bronchoscopy to go in there and get the coin out. Sometimes these can cause local inflammatory reactions, but typically they're not detrimental as long as you get them out. My wife had her gallbladder removed 3 months after having our son. She was in extreme pain that lasted 2.5 years until we found out that it could be a titanium allergy, and sure enough, it was. She got better 100% after the titanium clips were removed. So very interesting. So your gallbladder sits underneath your liver, produces a fluid, bile, that it's stored there, and then helps to digest fats when we have them in our diet. Sometimes you can get stones in there, or it may not function as it should. Typically, you remove the gallbladder and you put clips to basically block off the ducts and the vessels on that area. People have different allergies to different things, and obviously this individual potentially had an allergy to the metal that's in these clips. We worry about all these other things first, so we'll get images, we'll see the clips, continue to follow up, and see what makes it feel better, what makes it feel worse, and trying to figure out from there. So I'm glad this individual got better, but it also just brings to light that some things that might be so benign that we think might be causing the greatest problem. When I was younger, I ate a light bulb. It was a Christmas tree light bulb, not a regular one. After being rushed to the hospital and being x-rayed, they couldn't find it in my system. Luckily, it passed without a problem. Typically, these type of light bulbs are quite small compared to a normal size light bulb. Should still be picked up on an x-ray because they do have some metal components. If it's all plastic, you still should be able to pick it up. Now, if it's hidden behind something, it's behind a bone or over top of a bone on an x-ray, you may not be able to see it. It's probably small enough that they weren't concerned and allow it to pass through the GI tract. Typically, it has to do with size and sharpness for an emergent upper endoscopy to have a foreign body removed. We do see people who swallow a lot of different objects and they're typically fine. If they're small objects, they won't cause a perforation of the intestines, and you'll be okay. I stood up on a crate to hang some curtains from my mother in the basement. Getting down, something didn't seem right, and I stepped stepped on a glass fishbowl barefoot. Needless to say, my foot was cut wide open. Oh my gosh. Okay. Very common to have glass injuries. We have people that come to the emergency department with lacerations and puncture wounds due to glass and the feet. The bottom of the feet are very uncomfortable and painful, especially to try to then anesthetize and numb up to fix it, because the skin is so thick down there. That's why we're able to walk without any difficulty barefoot, and very rarely do we get injuries. Now, when actually something lacerates through it or punctures through it, the skin is very thick, so when we actually do sutures, we actually push really, really hard with the suture needle to close it after we clean it up. We'll typically get an x-ray because we may not be able to see it, but you can see it on an x-ray. Sometimes it's very difficult to then try to find it. I've had patients where they've had pieces of glass puncture into their tissue. It takes a little while to find this piece of glass blindly. If it becomes an issue, you can have a specialist do fluoroscopy, which is basically a special type of continued x-ray. So that way they have an x-ray while they're actually trying to find it, and so they know exactly where their instrument is relating to the object, especially if you can pick it up on an x-ray. Every year, we usually spend summer vacations in Morocco, and in 2012, in my second year of high school, I contracted malaria while we were visiting there. So hopefully the malaria was treated. Well, malaria, what the heck is malaria? Malaria is a mosquito-borne transmitted illness that is a parasite, and it is quite common, especially where mosquitoes are pretty much around the world, and it's quite common to actually have malaria in these areas. Treatment for malaria is medications. You can use Malarone, different types of antibiotics, and a whole slew of other types of medications that are quite common that can be used to treat malaria. Typically, people with malaria will get headaches, fatigues, body aches, and fevers, obviously, and typically we'll do blood smears to diagnose it, to look for abnormalities on the blood. So if you are going to an area, make sure that you talk to your doctor before traveling to make sure you have the appropriate medications, and sometimes you actually take prophylactic medications in these areas. The best thing is to talk to basically a tropical travel doctor, or just a travel doctor, and which will help the different things that you need to have, either vaccinations or medications prior to going to certain areas. I recently had to be taken to the hospital for a rabies shot. Bat flew into my face, then hit my leg when it fell from my face. P.S. It hurt like hell. So yes, so anytime we have bats around, sometimes their bites you can't feel, so we do get concerned for rabies. And rabies vaccination and injections are painful. So typically if you get exposed to something that might have rabies and got bitten, you first would actually get the immunoglobulin, which is actually like the rabies antibodies. That hurts. You have to get it injected all around the site where you might have had the bite or the wound, and then dispersed throughout your body. And these are all injections into your tissue. Very, very, very painful. And then you get your rabies vaccination. There is a 4-day and there's also a 5-day series. Typically you'd get it over 4 days, and it's spread out over the next probably 2 weeks or 3 weeks, just depending on the type of series that you're getting. Wow, thank you so much for sending in your stories. I appreciate you sharing your stories with us and allowing us a little insight into the things that happen to you and that we can all learn from. I hope that I was able to provide some information that was beneficial for all of you out there. If you enjoyed this and you want to see more, let me know in the comments. And as always, make sure that you binge watch this playlist right here. Please subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.